Our partners bring so much because they are the specialists. They know their patients, they know the struggles their patients have, but they often don't have the time, the headspace and the ability to make that change alone. And actually that's where we come in to support that.
Collaboration is important for transforming the NHS because when you collaborate, you bring different types of skills to the table. And that's what's really important for us at Boehringer Ingelheim in terms of the way that we approach partnership. It's not just about a monetary exchange, it's about a skill exchange as well to try and make our partnerships and what we're delivering in that system sustainable so that the individuals and the healthcare professionals and the healthcare providers are able to sustain that change within the system for the long term.
Working with Boehringer has been really beneficial to the project. I think it's with their expertise in project management, data analytics, just knowing what data we need to collect and kind of looking at that picture as a whole and being able to analyse it and present it in a really cohesive way. I think it's been really beneficial.
What we want to do is to work with innovative partners such as Boehringer Ingelheim to do something different, to try a proof of concept, such as this post. And this opportunity has enabled us to get the expertise of Boehringer Ingelheim in terms of project management, analyses, to look at the health economic outcomes from the original phase of the results we were able to demonstrate. So having that expertise, support and project management, which are skill sets that not often exist within the NHS, or if they do exist, incredibly hard to access.
Every opportunity that we see in healthcare, we have to work out how we can do it and think outside the box. And I think working with industry is one of the ways that we will be able to achieve kind of the goals that we have shared with patients.
We know that work with industry has in the past been viewed with some scepticism. We now realise that there is mutual benefit here. By working together in the interest of improving patient outcomes, we can do this.
So working in partnership with industry, for instance in this example is with the company Boehringer Ingelheim, has actually been very helpful for us. Certainly not just as a resource in terms of helping us pump prime the program to get started. And now that's started and we're actually doing things a lot more efficiently, it's helping us also save cost. So we're being efficient, we're being better in doing what we're doing, and then we're achieving better outcomes for our patients too, as well as saving the NHS money. I think we're all in a win-win situation.
Developing trusting, meaningful partnerships with our industry partners is absolutely integral to the vision that Health Innovation Manchester has. What do Boehringer bring? They bring a wealth of resource and expertise in their own area of chronic kidney disease. So we've lent really heavily on some of their clinical expertise, some of their resources using external providers who are experts in their own area, people like the Care Lab. So they're able to power boost the things that we do.
The benefits of the joint working partnership and collaborating with Boehringer has allowed me to focus more on patient care.
Boehringer have brought to the table many skills that we didn't even know we needed. We've had input from people who are really good at statistical analysis, data collection, even just presenting the data in a way that we wouldn't have known, and that's been really important for us.
As we strive here in the UK to embed our vision to transform lives for generations, that's exactly what we're doing here. We are sorting out the heart failure pathway for the patients of today, but also those that are coming tomorrow, next week, next month, next year.
I think these different kinds of collaborations and partnerships and working together are really, really important to making a difference.
We were working with the Faculty of Medical Leadership and Management, Boehringer and NHS England, and the FMLM have got lots of experience in training medics for leadership. We, from NHS England perspective, knew what we needed in terms of that focus on cardiac care, and we understood some of the challenges along the pathway we were hoping to address. And Boehringer are really supportive of us working together to develop the scope and focus for the programme.
Collaborations like this enable people to come together but also develop knowledge, share that knowledge, in a way that they might not have been able to do if we didn't have those collaborative agreements and partnerships.
So collaborative working in the way we're doing in this programme, but wider in our individual ICSs with our pharmaceutical colleagues, means that we can do the best for the NHS, for the patients and the country.
Our goal is always to co-create and pilot transformational yet sustainable solutions that can be applied elsewhere across the health systems, bringing further improvements to the benefit of patients.